So as I was just saying, hopefully whoever's just joined us can see the screen that I'm sharing. So yeah, as I said, it's a combination of having a little bit of a look at stress and anxiety, but also having a look at self-care and self-compassion, which are two things that we tend to let slip, and especially when we've got lots of stress and anxiety around. And I feel really sorry for you Aucklanders, because gosh, you're going in for another 4 days of level 3, and the rest of us are out of Auckland are in level 2. So some of these things will be quite relevant for how you might have been feeling. I certainly had a little bit of a reaction when the news was announced that we would be going back into level 2. So here's the outline of what I'm planning to cover tonight. And it's really to acquire a shared understanding of stress and anxiety and the signs of these, and also to discuss some helpful and unhelpful strategies for you. So basically, what is stress? So stress is the feeling of being under too much mental or emotional pressure. And this pressure builds when you feel unable to cope. A bit of stress is normal, and actually we can't live without a little bit of stress in our lives, because if we didn't have it, we wouldn't have the motivation to do something that was new or difficult. But it's when we have too much stress that it can really take its toll on us. Now, anxiety is a little bit different. It's more of that real feeling of unease, such as worry or fear, and it can be mild or severe. Now, everyone has feelings of anxiety at some point in their life. It would be very unusual for anyone to say that they didn't have any feelings of anxiety at all. Some of us might be worried about meeting new people, and we might get a little bit anxious about that. Maybe starting a new job, or even for me today, presenting in front of a group. I can have that kind of, flutters in my stomach, or my heart might be racing a little bit. And it's absolutely normal to feel anxious during this time. However, some people find it hard to manage their worries or anxieties. So these feelings of anxiety become more constant and can actually often affect their daily lives. Now, this is a really old curve. I haven't been able to find anything newer, although I should probably hunt for something. It's from 1979, so it's particularly old. But what it demonstrates here is that we have good stress, and then we get to a point where it rolls over into distress, okay? And this is where we want to try and avoid ourselves going to. You'll sort of hit a point in the middle there, you'll see the fatigue. And we do have a comfort zone that we sort of like to sit in, which is, that easy place where everything's going nicely in our lives. Now, if we're going over onto the distress side, we actually start to feel some really ill effects. And so there's the exhaustion, so actual performance drops off, and then we get into exhaustion, and we actually might become quite unwell. So what does stress actually look like? Well, we all know that stuff happens. Stuff happens to everybody, and we perceive it. So we have thoughts that occur when we think about things. So emotional, physical things happen, and we react to them. Okay, so what I'm saying here, that things will happen to us, we'll have a thought about it, and then we'll actually get some emotional and physical responses to that. So a classic example for me is that I could have a thought tonight that the people out here listening to me don't like people with grey hair. So I start thinking this thought, and I start to get nervous, because obviously I've got grey hair, and physical sensations begin. My heart rate increases, My hands get sweaty. Now I can interrupt this from happening. I've still got the thought in there that everyone dislikes people with grey hair, but I can notice the thought instead and actually ask myself if it's true. Now this is called noticing, and it's actually a mindfulness technique. So by actually noticing that I'm having that thought, I'm having the thought that everybody dislikes people with grey hair out there, and just almost like stepping a little bit outside of your body and looking in and going, is that actually true? And having a little bit of a think about that. No, probably not true. So reactions will start to lessen. Does that kind of make sense to you? So if you'd like to unmute yourselves, and it's a little bit difficult in these Zoom meetings, it's much easier in a group situation, but what are some of the common reactions to stress that you guys are aware of?
Do you want a response?
Yeah, if you can shout one out.
A verbal response, not a written one.
No, you can, well, I can see the chat box over there, but you can certainly shout them out as well. Hi, Jackie, you've just joined us. So we're just shouting out some of the common reactions to stress.
Mine would be tightness in the chest, actually, just tightness.
Oh gosh, as a nurse, we wouldn't like to hear that. We might be taking you for an ECG.
I find headaches and tension around the shoulder area quite common. Also skin reactions.
Yes, yep, common ones, yeah. Any others out there?
For me, it would probably affect my sleep.
Right, yeah. And that's a common one, and that can be quite debilitating.
Yeah.
Because if you're not sleeping well, that kind of becomes a cumulative effect and lots of other things happen for you. Yeah. Thanks, Nikki. Anyone else got anything out there?
Mine would be my mood.
Vicky, is that you?
Yeah.
Yeah. So do you notice a drastic change in your mood?
Yeah, I get quite angry and grumpy, mainly at the kids.
Yeah, you are the mother of 3 very little children, so
yes,
it's probably okay. And actually something that you don't need to necessarily beat yourself up about.
Yeah, I guess so. Don't know if my husband would think the same thing though.
Okay, yeah, often it's the other people in our lives that are more affected by it. So moving on, for those of you that are nurses, as in a few of you in this group, you'll have an understanding of early warning scores or early warning signs of stress. And these are a good list of them here. So we have the different types, the psychological, behavioural and physical. And in psychological, it can be things like our concentration goes, we become a little bit more forgetful, maybe we become indecisive, we have a loss of confidence, loss of pleasure, our sense of humour goes, we become a little bit irritable, agitated, maybe we have mood swings, and tearful and fearful. And then in behavioural, they can be things like being clumsy. I find in a number of my clients that procrastination is quite a biggie for them. Nail biting, being inflexible, interrupting more, being impatient, withdrawing. And then of course there's the things that affect us, like changes in our alcohol use or eating, smoking and drug use. And those are often what I would call buffering behaviours that often have an underlying reason for doing them. Aggression, libido changes, and maybe even overspending. I'm quite good at that. And then physical, so skin changes, sweating, heart rate. You might have trouble with your bowels, tiredness, sleep patterns get altered, muscle tension, which you've alluded to, increase in stomach acid, which can actually have a nasty effect on your stomach, and then maybe you also might get more frequent colds. And with all those, we actually become all these things here. We become tired, angry, kind of overreactive, maybe a little bit depressed, maybe more anxious. We lose our confidence. We might buy into gossip, and we also might blame others for things that are going on for us. So how can we actually help ourselves here? We want to try and become a little bit more effective and less reactive if we can. Actually behaving like we are our own best friend. And I often use this with clients because we tend to be incredibly self-critical, very hard on ourselves. As Vicky was, Vicky's a mum of 3 little kids. And so, actually being a little bit nice to yourself sometimes does work. Meditation and mindfulness help us get more connected, which in turn also improves our self-value, self-belief, self-respect, self-acceptance, and self-confidence. So there are things we can do. Now, I picked this up from a presentation that I was listening to on stress, and I thought it was really quite valuable, because what it's saying here, that there is an actual stress equation. So we all have demands on our lives, but if they are greater than our perceived ability to cope, then we encounter stress. Okay. So what is changeable in this equation? Can you change your demands? Does anyone think we can change our demands?
I think it's how you react to those demands. Depends if that demand is actually important, or sometimes it just seems like it's a demand. It's sometimes you hear those. We learned that in our coaching, and what sometimes if something is urgent but not necessarily important, and then,
the quadrant,
you can actually be living in that stress situation of being totally reactive.
So in a sense, you can change your demands. Sometimes it'll be difficult in a work sense, but maybe you are putting too much onto yourself. And a lot of people will be juggling work and home life, children, doing after school activities, all those sort of things that take up extra time, that perhaps they could change some of those demands. A lot of people talked about this during our first lockdown, about how much more time they had because they weren't running around doing all the things that they normally did. So the perception is that we can change some of our demands. Can we change the perception of how we think about those demands?
Yeah, I guess you can.
Yeah.
If you feel that there is as I say, it comes down to whether it really it's just a perception of is it of high importance, or it just seems urgent. It could be like an unpaid bill.
And sometimes just a little bite of some of those things that I've heard recently, like tackling a couple of things that are easy to finish early in the morning, sets you up for being able to do a lot more difficult things during the day. So it's called eat the frog, isn't it? I think that's what they coin it as. So can you change your coping skills?
I think you strengthen them, can't you?
You can improve them. Yeah, definitely. So all those three things can be changed to help yourself with stress. Obviously, in the moment, you might go, oh, maybe I can't. But if you actually sat there and reflected and thought about it, what can I change here that will help me deal with this better? Now, this is something I came up with, and a lot of you will know about Maslow's hierarchy of needs. And for me, this pyramid was similar to that, except a little bit different, I guess. So what I'm saying is down the bottom, to support us all the time, what can you do every day? What do I need to do to get well or stay well? So when I'm having a fantastic time, life's going along as it should be, and I'm happy doing everything I'm doing, what are those things that I'm going to always do to maintain? Okay, so you build yourself up. Then for when you move into that next step up, that's sometimes making good days. So what sustains and nurtures me? And then up the top, we've got really, so managing the bad days. What do I need to do or not to do on these days? So what can you take out of those bad days that are actually putting extra stress on you? Okay. So having that baseline of having routines, things that you do to keep you well along the bottom there, so that when you get to those managing bad days, you have just the minimum sort of baseline that you do on those days. And this is what I say, is that you have, what's the absolute baseline that you can do to actually keep yourself well? And think of a really bad day and how much time you're prepared to put aside to look after yourself. Does 5 minutes seem like an achievable amount on a really bad day? What could you do in 5 minutes?
You do a bit of meditation, actually.
Yep. You could do a bit of breath work.
Yep.
And, extend it maybe out to 10 minutes. You could do a little bit of meditation. Yeah. Good. So it segues into this very nicely. So mindfulness, just what is it and how does it work? So I'm sure if you've done anything with mindfulness before, you will have heard about Jon Kabat-Zinn, who was the professor of medicine in Boston, who was the founder of the mindfulness movement. And he came up with this very simple definition, which is the awareness that arises from paying attention on purpose in the present moment and non-judgmentally. So the benefits of mindfulness, it makes us a lot less reactive. It also gives us more choices and options in working with our life and prevents relapse of depression, reduces clinical depression, anxiety, anger, rumination, and enhances cognitive flexibility and attention. So all those benefits have come out of the evidence. There's been a lot of research done on it, and these have all come out as evidence of what mindfulness can do for you. Now, some of you will know this as well, that we have emotions, of course, thoughts and feelings, and these are processed in the limbic system, which sits there in the middle of the brain in my picture. So particularly in the hippocampus, the amygdala, and the hypothalamus. Our brains are wired to always look for danger in order to keep us safe. And if you've done any psychoeducation, you'll have the understanding that we we came from an evolutionary point of view. We lived in caves, and if you put your head out the cave entrance and there was a tiger waiting for you, your brain told you to go back inside and not get out. Okay, and this was the origins of our sympathetic nervous system, which has stayed with us all the way through the evolution of us, and it's our fight, flight, and freeze part of our brain. Okay, so you can lessen the severity of these emotions by practicing mindfulness. Mindfulness works on this part of your brain. Now, the survival mechanism in our brain actually trumps the critical thinking. So that primitive part of our brain, which is in that limbic system, is always in a bit of a challenge with our logical brain, which is in our prefrontal cortex. So by calming that sympathetic nervous system, our fight flight, it helps us to then be able to think more clearly and have the option of a healthy decision rather than an unhealthy one. So when anxiety or conflict are present, our mind quickly goes to that reactionary phase, like, are you against me or with me? So being present really allows us to slow down our heart rate, slow down our physiological response, and to then be able to access our logical brain, so that prefrontal cortex. We also have a brain that's very conditioned. So we get conditioned from when we're children. A lot of things that we carry around with us now have come from our childhood. The way that we react to some of our emotions have definitely come from childhood. So the brain likes to take the easy way out in a stressful situation, and it will search for how it reacted to similar situations in the past. And our brains are problem-solving machines. Classic for me is that I needed to clean the skylight on our roof over the weekend because it was annoying me. And, my husband's afraid of heights, so he wouldn't get up on the roof. And so good old me went up on the roof, and I said to myself, okay, I'm on a roof. It's a little bit scary, but I'm okay. And so, of course, my brain was saying to me, oh, it's really dangerous to go on a roof, and, you know, you might fall and and all this kind of stuff. But by being careful, I knew that I was putting as much safety stuff as I could in place, and I did it. And it was, you know, the fear, the brain fear was there. It was trying to tell me not to go up there and do it, but I wanted it done, so I went and did it.
Well done.
So, ways to calm the nervous system. Now, breathing, as I've just said, helps immensely with calming it. And breathing actually connects the ventral vagus nerve, which is one of our main nerves that comes down from our brain and into our abdomen. And it's the prime driver of our parasympathetic nervous system. And you can do something as simple as 3 letting go breaths, and that's breathing slowly, easily, breathing through the diaphragm and breathing through the nose. The other one that I find quite useful is to do using your senses to get into the present. And this is a typical Russ Harris technique. I think he calls it dropping the anchor. When you place your feet on the floor and really get into the present moment and use your senses. So you use your eyes, you have a look around the room and notice 3 things that you can see. And then you use your nose, maybe what can you smell, what can you taste, what can you feel? Okay, so using that, and that's about getting yourself into the present. And then a wonderful one that I've learnt for children is called 5-finger breathing. And probably a little bit hard to demonstrate over Zoom, but it's about breathing with a child. So telling them to take a breath in and using their finger to follow their fingers around. So breathing out, so breathing in and breathing out and breathing in and breathing out. And these are things that can be practiced actually unseen, or in a very private way without anyone actually knowing what you're doing, in a busy area, in a workplace or in a board meeting. I know that a friend of mine in Auckland who teaches mindfulness actually teaches some of these techniques to CEOs. And basically they can do them under the table or at the board table without even knowing that they're doing them, other people doing them. So self-care is the next thing I want to talk about. Why do you think it's important to look after yourself?
Maintain your general health and well-being. And particularly in a situation right now where there's a bit of illness out there, I think general health is pretty important.
Yeah, it is, definitely.
Mm.
Anyone else want to pipe up?
I also tend to think if you don't look after yourself and if you're not in a good way, you're no good to anybody else. Oh, really?
So true, Nikki. It's so true. And why do we always put ourselves last then?
No, I'd love it if you could tell me that.
It's quite a common thing, and
Yeah.
especially for women and mothers. And often we put ourselves just a little bit too low.
I'm the queen of putting myself last. Nikki
Yeah.
tells me all the time I'm not doing a good job of putting myself first.
Okay, I'm going to help you with that, Vicky. All right. Now there's a word here, selfish. Does that word bring up negative connotations to you?
Yes.
Yeah.
Yeah. Why? Why is it a word that's just what we've been told? That being selfish wasn't a very nice thing to do?
I think I probably grew up thinking if you were selfish, you couldn't care about other people. And so I always considered myself to be more caring about other people. So therefore I couldn't be selfish, or to be selfish would be against what I am. But actually, I would probably be better if I was a bit more selfish sometimes.
Yeah. We're so busy often putting other people before us that we actually treat ourselves worse than we treat anyone else. And so a little bit of selfishness goes a long way. And it's only because we've been brought up to think that selfish is a bad word that's what it brings up in our mind. It's one of those real learned emotions again. So self-compassion is something that I am incredibly passionate about. So self-care activities are actually those things that we do to take care of our mental, emotional, physical and spiritual health actually. Countless research findings demonstrate the importance of it, and self-care has actually been found to increase empathy, immunologic functioning, so actually our immune system improves, and has been associated with lower levels of anxiety and depression. So when you put it that simply, why are we not doing this for ourselves? If there's research out there that says how good it is for us, then why aren't we doing it? Now, the same authors came up with these 5 S's for well-being and resilience. So self-care was top of the list. Saying no was next. And last time I gave this presentation, I was in a residential care facility in Cambridge. And they all laughed when I said saying no, because obviously it's one of the hardest things for people to do. Setting boundaries, sleep, and sitting still, so using meditation and mindfulness. So those 5 things there will actually help you improve your well-being and resilience. So how do we factor these into our lives? Simply doing kind and caring things for ourselves, particularly when we are struggling, can actually help us to cope and move through difficult emotional experiences. Self-care activities can be sensory, emotional, physical, spiritual, and social. The idea with initiating self-care and integrating it into everyday life is to find out what feels good to you, something that you genuinely enjoy doing and that fits with your lifestyle and your values. Doesn't sound that difficult, does it? And here's some of the things that you can actually do under those headings. So you've got your emotional self-care. So there it is, learning to say no. And that's a difficult one because you've probably said yes all your life. And learning to say no will be quite a challenge. Intentionally scheduling me time on your calendar or your planner. Rewarding yourself for completing small tasks. Using online tutorials to learn something new. There's amazing podcasts out there now. Developing a relaxing evening ritual. Allowing yourself to feel and express all of your feelings in a safe and appropriate environment. Try some mindfulness. Try some adult colouring. Remind yourself of the good stuff in life by writing a list of things you're grateful for. Take a moment to allow your feelings to be present without judging them. And stop being your harshest critic. Actually allowing yourself to make mistakes is okay. Physical self-care, doing some stretching exercises, and that might be the 5 minutes that you have on the really bad day, is that you just might spend 5 minutes doing some stretching. Taking a walk, drinking some water, getting a massage. It might be pretty hard these days for Aucklanders. Go out and spend 10 minutes under the sun. Go for a bike ride to nowhere in particular. Hiking, tramping. Go to bed early. And that's certainly something that I tend to do if I'm feeling a bit worn out, that I'll just hop into bed and read a book a bit earlier than I normally would. Social self-care. I love the top one. So try and avoid those people that aren't so good for you. Ask for help. let people know that you need some help. Call a friend or family member. Choose who you spend your time with. Spend time with people who are enthusiastic and positive. And intentionally reconnect with someone you've lost touch with. Maybe join a support group for people who are going through what you're going through. Schedule a regular date night with your significant other and take a road trip with your siblings. I thought that one might maybe not be such a good self-care habit for me. Spiritual self-care. So make time for meditation in your day. Do a 10-minute body scan technique to check in with each part of your body. Do something nice for someone in secret. Donate money to a charity of your choosing. Help someone in some way and find an opportunity to use your strengths, the things that energize you more often. Now, one of the other things that I have here is an activity for you. And this is something that if I had you all together in a room, it would be something that we could do as a group. It's a vision board. Now, I'm not sure whether any of you have got vision boards at home yourselves. I have one above my desk, and I created it quite early on when I started my coaching business. And that was because it's there as a reminder for everything that I am wanting to achieve in my business, and something that I can look at every day and just remind myself, really. But I loved this idea of creating a self-care vision board. And I thought it would be a fantastic activity to do with people. And certainly something that you can go away and do yourselves. And if you do, I would love to see a photo if you do it. I started with a white framed corkboard from Kmart to put my pictures on. And so you start off by brainstorming the self-care activities, the things that you want to do. Try and be as bold and creative as you can, but only include the activities that you would genuinely enjoy doing and fit with your lifestyle and your values. And you'll see that, you know, in those 4 slides there, I had a good list of all the things that you could add on there. And then collect images for your vision board. So I used magazines to do mine, and find positive images that correspond with your chosen self-care activities. Look for images that really resonate with you and inspire you. You can use the internet, magazines, photos, and use photos of activities that you can do to take better care of yourself and your needs. And you can also collect words. So I've got a mixture of images and words on mine. And you basically can add phrases like quotes, words that reflect or relate to your chosen self-care activities. Okay. And then lastly, you put it all together. And so once you've got all your images and your inspiring phrases, you just get creative in your arrangement of it, and you've created yourself a beautiful vision board. I'm just going to get out of my presentation. Oh, of course, my mouse has gone off to sleep. I'll just stop recording.